Hi, good afternoon, everybody, and welcome to this Digital Care Hub webinar all about changes to the Data Security Protection Toolkit. We have lots and lots of people who've registered today. You're all very keen to know about all of the different things on the DSPT, so we will get started in just a couple of minutes, but we're just going to let everybody have time to actually join the meeting and find the link. So you are in the right place, but we're with you probably about 2 minutes and we'll make a start. I'll just say the sound is working. We're just letting everybody have a chance to join, so we'll be starting in probably about 1 minute. Thank you so much for joining us. Right. It looks like numbers are starting to slow down a little bit. So I think we'll make a start just so we're not wasting anybody's time. Thank you so much, everybody, for joining us today. This is a webinar all about new changes to the Data Security and Protection Toolkit. This is specifically focusing on the social care provider view of the Data Security and Protection Toolkit. And so we'll be focusing on what is relevant to anybody who completes that organizational profile. My name is Katie Thorne, and I'm the digital lead at the Digital Care Hub, and we host the Better Security, Better Care program, which supports adult social care providers around completing the DSPT. And I'm joined today by my colleague Claire. Claire, would you like to introduce yourself quickly?
Yeah, good afternoon. I'm going to be manning the chat. Mark, I am coming back to you with an answer. I'll be with you shortly.
Great. Thank you, Claire. Claire's going to be across all of the detail for me. And also my colleague Rihanna is going to be in the background running slides, making sure this is recorded, and we'll send the slide and recording out to all of you as well. Next slide then, please. So as I mentioned, this webinar is being recorded. All attendees are on mute and we can't see you, I'm afraid. So it's a little bit strange. I know there are people there but can't see what's happening. So please do use the Q&A function if you do have any questions. This just allows Claire and Rihanna to keep on top of them for us and make sure that we don't miss anything. There is also a chat function. If you are having any technical difficulties or would like to introduce yourselves, please do say hi in the chat. Lovely to see you in there. You will get access to the recording and the presentation, and if there are any questions which we don't have time to get to in the course of today's presentation, we will make a note of all of these and we will send a Q&A sheet out to all of you afterwards as well. So do not panic if we don't get to your question. For today, we are going to talk about the new mandatory questions which have been added to the social care view of the DSPT. We're then going to go through the questions which have had wording changes and what that means for you and your organisation when completing. We have also new resources and guidance specifically for care organisations on how to answer these new questions. And we'll run through as well the support options which are available to you to help with republishing. And hopefully have lots and lots of time for Q&A because there's not a significant amount of changes. So wanted to make sure there was lots of space for people to ask questions. So for those of you who have completed the Data Security and Protection Toolkit in previous years, you'll know that there were 43 questions to achieve standards met previously. 2 new questions have now been added, so standards met will now require you to answer 45 questions. These two new mandatory questions are have all of the administrators of your organization's IT systems signed an agreement to hold them accountable to higher standards. So that's anybody, whether internal or external, who manages your IT for you. And we'll go through that in a bit more detail next. And then also 7.1.1, where you have an asset register detailing your organization's hardware, software, and data, which is kept up to date. So on the next slide, we'll go into a bit more detail about what this means. So this question used to be not mandatory, and the wording of it hasn't changed. The only difference is that this is now mandatory for care organisations. It will apply to any external IT sysadmins that you work with, as well as anybody internally. And basically what it means is that you will need to have a agreement in place with anybody who has privileged access to your IT systems, which says that they know that they are accountable for their actions, they acknowledge the higher role and access that they have over other people within the organization. We've developed new guidance to support with this, including a template that you can use particularly for any contracts you have with external IT consultants, but that also can be adapted for any internal sort of staff contract clauses that you may need as well. Next slide, please, Rihanna. And then the other new mandatory question. So the DSPT has asked you in previous years for an information asset register and for you to talk about your data processing. And so now this is an asset register talking about your organization's hardware, software, and data. So you need to keep a record of the different computers that you use, the devices that you use, any software programs like your care records, your rostering, your finances, all in one place. You need to review this at least annually, though you may wish to do so more frequently, particularly if you're adopting a lot of new systems or if you go through tablets and devices quite quickly and you're needing to replace them. You do have an option rather than having this as a standalone document. You can choose to have it combined with your existing information assets registers. And we have developed a whole new quick guide talking about digital asset management and giving you different options on how you might like to approach this so it's not as burdensome as it could potentially be. Next slide, please. So those are two new questions. Hopefully nothing in there which is too stressful. As I said, one of them has been in the toolkit for a long time, just was never mandatory. So that's where we are. There have been wording changes to a number of questions. So if you log back into your toolkit, you might see that there are some small differences. We will be sending these slides out to everybody, so you'll be able to see the differences yourselves if that's useful. So some of them are quite short. So for example, in the does your organization have a privacy notice? The tooltip has an addition and it says that you must now provide this in a range of formats for different audiences. So for example, you may want to have it in an easy read format if you're working with people with learning disabilities or cognitive impairments. You also might want to have it available both in a physical hard copy to give to people and also online on your website or in a digital version, which you can email. You know what's best for your organization, but you just need to make it as accessible for people as you possibly can. For the next question, 1.1.5, previously you would have been asked who is responsible for data security and has this responsibility been formally assigned? This has been strengthened somewhat this year. So now we said that the approach to cybersecurity is owned and directed by senior responsible individuals. And there must be regular discussions driven by the individuals who have that overall accountability for security. So you can use the same evidence that you've used previously, but you may also wish to provide evidence about regular meetings to discuss security and data protection happening within your organization as well. For 1.3.1, does your organization have up-to-date policies in place for data protection, data and cybersecurity? They have added that this must be aligned with good practice guidance and, where applicable, national policies. All of the policy templates that we provide for you on Digital Care Hub are being updated to make sure that they're aligned with national policies and with guidance, and we keep these under regular review. If there are any significant changes to them, we will make sure to go out to everybody and let you know that that's the case. Next slide, please. The training question. We get so many questions normally about training. On the one about have at least 95% of staff completed their training. There is a small addition to the tool tip here. So it suggests that you should use a range of training and awareness methods to reach all staff effectively. So what's right for one member of staff to be trained on data protection, cybersecurity might not be trained right for another person. So look at different options about how you can approach data protection and cybersecurity for staff. That might include using the free e-learning modules, which are available for staff, but also having conversations in supervisions or potentially in-person training as well, if that's right for your staff teams. For the question around business continuity plans, which cover data and cybersecurity, you must make sure that your plan should include communications with other organizations and your data protection obligations. So that means that you need to list any other organizations you work closely with, potentially who might have access to your data or who you share data with, to let them know if there is something which they should be aware of, particularly if it's relating to a cyber breach or a data protection incident which is reportable. And you need to make sure that your staff really understand the plan, much as you would with your broader business continuity plans. If, a member of staff was asked by CQC what they would do if there was a fire, for example, staff need to know what would happen if there was a power outage or if you lost one of your systems because your software supplier was having a cyber attack and so you couldn't access it for a period of time. Right, sorry, that was a bit of a downer of a one. 7.3.4. Yes, I will talk more slowly. I'm very sorry about that. So on backups, so there has long been question asking people to check backups, but this has now added an additional information into the tooltips. So your backup plan, which hopefully you will already have if you've completed the toolkit before, must also list which systems you need to recover and in what order. So you want to prioritize your systems based on how important they are for the running of your organization and for the care of people. So potentially digital care record systems, if you're using them, electronic medication administration records, you need to know which ones would be most damaging if they went down, most likely to cause harm, and have them prioritized as a risk order. Next slide, please. And this is the final wording change, so just 7 wording changes this year. And that is around how does your organization make sure that the latest software updates are downloaded and installed promptly. That's the only addition this year. You need to make sure that if you get an alert on your computer system, which tells you you need to do an update, that that is responded to as soon as possible and it's not delayed all of the time by members of staff. I know they always pop up at particularly unhelpful times, but that's the only additional change there. Next slide, please. So there has also been new guidance which has been developed for care organisations, particularly linked to the new questions, but also things which you may find helpful in general. All of these are already available on the website. The links we can pop into the chat for you, and you'll also receive them in the slides as well. So the first one is all around how to encrypt your devices. This includes a step-by-step guide on how to use the inbuilt encryption software, which is available in Windows computers, also Apple devices. For smartphones and tablets, the majority of them have inbuilt encryption already there by default, but there is a way that you can check if that is the case. We also have detailed guidance for a variety of different removable devices, and also different options that you can look at. So if you use Windows, for example, you might have Windows Defender automatically on your computer, and it will have an encryption option that you can use. There are also other paid for and free versions on the market, which you might look to use instead of the ones which are built directly by Windows or by Apple. And so our cybersecurity lead, Sam, has gone through, has suggested different options that you might like to look at. And there's lots more detailed guidance there for you to work through. Next slide, please. And this is actually a pre-announcement of some guidance, which is going to be coming from next week, I believe, is when the formal launch is. Though Claire will correct me if I'm wrong. And so this is the first time we're talking about it publicly. We're very excited about it. So we are developing a bring your own device policy builder. We know that for many care organisations, staff use their own phones for work purposes, which is absolutely fine as long as you have a clear and robust policy for it. We have had template policies which we provide for free at Digital Care Hub for a long time for people to use, but this now will be provided in an app format. This allows you to build and customize your policies so they're more bespoke for your organization. Previously, you would have downloaded a Word document or an Excel template, and then there would have been sections which say, insert your organization's name here, put your specific policies here. Instead, this is an app. You can work through it very, very quickly on your own. You can say, yes, this is relevant to me. No, this is not relevant for me. And that will all be available for free. It's available on mobile and on desktop as well. And it avoids you from relying on cut and paste template policies, which we know has been something we've had a lot of feedback on in the past. The first policy, which is being developed, is on bring your own device, as I mentioned, but there are lots more policies to follow. So we're updating our entire suite that we offer. Next slide, please. We can go through some of those. So these are the guidance areas that we will be covering with the policy builder once the Bring Your Own Device one goes live first next week. So talking about data quality, how you're making sure that you're having high quality data records and making sure that's embedded into how staff are working with information within your organizations, data protection, data security. We are updating the information asset register as well from an Excel spreadsheet, which we know lots of people didn't like having to do it in Excel, to this app format. We'll also have the digital asset register, which is currently live and available as a Word document. That will be available within the app as well. Also, more guidance around record retention, checklists for how to audit what you're doing from a data protection and cybersecurity perspective, contracts with third-party suppliers as well, and things that you need to make sure you're looking out for in them, and also an acceptable use policy for any corporate-owned devices which you might be providing to staff. And there is just a screenshot on the right-hand side here as well of sort of what it will look like as a policy builder and how you can use it. Claire, was there anything that I missed on the policy builder that I should tell people at this time?
No, I don't think so. If you just want to pop any messages into the chat and into the Q&A, I will attempt to answer them. Vincent, you've put your question into the chat, but I can't answer it there. So if you just want to repeat it in the Q&A, I'll be able to send you a link in there.
Great, thank you, Claire. Rob. Great, and next slide then, please. Oh, and just back one. Perfect. Thank you. So I know many of you will be aware of this, but I just wanted to do a reminder that there is a full program of support for adult social care providers with completing the Data Security and Protection Toolkit. This is run by the Better Security, Better Care program within Digital Care Hub and is fully funded by Department of Health and Social Care and NHS England's Joint Cyber Unit to be the free support offer to adult social care. We have lots and lots of online guidance and step-by-step films on how to answer all of the questions. The films are currently being updated to have all of these wording changes added into them. It takes a little bit longer than throwing some slides together. But for most of the questions, if you are currently completing the toolkit, those films will still be relevant and helpful for you. We do lots of webinars like this one with new changes. Also, for anybody who's never completed the DSPT before, we run webinars as well to help you through completing it for the first time, hints and tips for things that you might like to think about. We run a helpline as well, which is available Monday to Friday, 9 to 5, if you have any questions. But also we fund 28 organisations across England to provide direct one-to-one support for care organisations. If you don't know who your local support organisation is, or if you would need to get in touch with them, you can find all of the contact details on our website, or you can get in touch with our National Help Desk and we will refer you on to who is the person in your local area who can give you a phone call and walk you through everything that you need to know. We also have specific advice for any new care services. So if you are looking to set up a new CQC registered care service or to add an additional organisation into your existing business, there's hints and tips there for things that you can think about while you're getting your policies in place prior to registration. As ever, please do get in touch with us though if there's anything that is missing. We're always looking for more ways to support the sector. So I will keep an eye on the chat or any questions coming through about that as well. I believe that might be all of the slides.
Katie, I do have a question that you might be able to answer, but I'm not entirely sure. Just to confirm that we support adult social care. So some of the questions that are coming in are from other sectors, so we might not have the answers for you straight away. So one of them is, are Google and Microsoft survey pages secure?
That would depend on your organizational setup of how you've got that done by your IT. So yes, they are secure in general, but I don't know the exact way that that's been set up in your organization. So if we would use Microsoft Forms, for example, and we know that that's okay within our tenant. If you are using Microsoft through NHS Mail, and so the N365 environment, then yes, that is all managed for you, and you can be assured that that would be secure.
And somebody else has asked that the new to DSPT, and do PCNs need to complete the toolkit? If yes, is there a dummy guide that they can look at?
PCNs for primary care, yes. So primary care organisations do need to complete the toolkit. It'll be a slightly different version to this one. If you go to the toolkit website itself, again, we can pop that into the chat. There are specific webinars for primary care, secondary care, acute and social care as well. And there are also what are their specific guidance documents which have been developed for NHS organisations on completing the toolkit as well.
And then maybe I could answer Miral's question. If you've already got Cyber Essentials, instead of repeating information on the DSPT, is there any plan to have a cut down version? Actually, some of the questions on the DSPT show as complete if you put in your Cyber Essentials Plus certificate. So when you're first registering onto it, you'll be able to put your certificate name and expiry date in, and then the questions that are covered by that, they disappear and the show is complete already. So you're not having to repeat the information that is already populated for you. Somebody's mentioned there's music in the background. That isn't something that I've heard at any time. Have you, Katie?
I don't have any music in the background. I'm sorry, I can't turn that off.
Okay. Mark's got a question about something that I can't help with him directly on the call, but if you maybe just want to send an email to hello@digitalcarehub.co.uk, we can maybe jump onto a call with you afterwards to just understand why you're not showing the CAF aligned version of the DSPT, even though you're registered as an IT supplier.
Great, thanks, Claire.
And then there's a question about, are we planning to do a session on the leadership or board level members around cybersecurity?
It's a really, really good question. So we do have e-learning at the moment, so aimed at frontline staff and then also for people with more senior responsibility around data protection. We could absolutely look at running a more detailed webinar looking at cybersecurity for people at board level in particular. I think that's a really good idea. Happy to take that away and do that. We're not looking to develop any more e-learning specifically for board or exec level people at this time, but there are quite a lot of cybersecurity qualifications that people can choose to access if they do need more information. But we don't endorse specific training products, I'm afraid. Skills for Care have a whole list of different Assure products, so they might endorse particular cybersecurity ones.
And will there be a list of auditors that can be used to verify the submissions? And just to clarify for most people on the call, you only need to get an external auditor in if you are in a higher category than adult social care. So if you're an IT supplier, for example.
Yeah.
I'm not aware of a list of auditors that is available. The big ones can be quite costly,
Yeah.
but I've put a link into the chat about everything that they need to have to be able to complete the assessment. So that might be a starting point, and then approach some people and say, are you able to perform all the functions of this audit?
Right, thanks, Claire. Just having a look if we're missing any other questions which are coming through.
So with the Cyber Essentials certificate, where is the best place to get the certificate? Is it separate from the DSPT? So just to clarify, there are two levels of Cyber Essentials. There's Cyber Essentials and the Cyber Essentials Plus. So once you've completed that and you've gone through the whole process, you'll be given a certificate that might be a paper version or it might be an online version, and it will have a certificate number on it. So if you're using your Cyber Essentials Plus certificate, that will be able to be used in the DSPT, and that will show some questions as completed. But if it's Cyber Essentials only, that won't take away any of the questions from the DSPT. It's only the plus version. But it is completely separate from the DSPT, so you won't have a certificate from the DSPT that covers Cyber Essentials.
And then I can see that there's one about how do you get certified with exceeds requirements rather than meets requirements. So you can get standards exceeded by completing every question within the toolkit rather than just the ones which are marked mandatory. So there are significantly more than the 45 questions which I mentioned on the webinar today if you want to reach an exceed standards level. You can do it. There's no requirement to do so, but we do know that there's part of the sector who really wants to go above and beyond with all of this.
Yeah, and somebody has asked, is there any requirement for our IT partners to have any certification beyond Cyber Essentials Plus? So it would probably depend on how big you were and what services they're providing to you. Cyber Essentials Plus is one of the things that we ask people to look for, but there's other things like ISO 17020, whether they have that or if they've got other kite marks. It's actually in one of the questions for the DSPT. It gives a breakdown of all of the different certifications that we'd be asking you to look for. They don't need to have all of them, but if they've got at least some of them, you can be assured that they are meeting the standards required.
And if any of your software suppliers hold any data which is about somebody's care, so digital social care record solutions, they should also complete the DSPT themselves and do an IT supplier category. If you have purchased a digital social care record solution as well, which is currently on the assured solutions list, that is one of the requirements for any of those software companies to have already completed a DSPT. So you can check there. And then from Joe, if the IT admin person for a provider is the owner, do they still need to complete the agreement? Assuming yes. Yes, I agree, Joe. They would still need to sign a privileged access agreement. It's basically a recognition that they have more access to data and control over the system than other people. It depends on the setup, but it may be that as an owner, they wouldn't normally be involved in direct care, so they might not see all aspects of a care plan, but technically as an IT admin, they would be able to see that information. So it's just having that recognized basically in your contracts and in your policies.
Katie, there's just a message from Meryl in the chat. See that one?
Sorry.
To discuss 7.2 around data and managing expectations.
Yeah, that's fine. We're all happy to have a conversation with you about managing expectations and what's required for 7.2. Yeah. I will add, if you contact, I'll put the email address in the chat as well. If you do hello@digitalcarehub.co.uk or come through to me directly at Katie@digitalcarehub, then that's fine. And then just seeing, we have the DSPT toolkit, NHS digital certificate. Do we need to do anything else? If it's an up-to-date one, then No, that's absolutely fine. You need to complete the DSPT on an annual basis, and the deadline is the 30th of June every year. So if you've done it right now, great. Make sure you republish by June of next year. Um,
And Lindsay's asking, is the requirement for an IT supplier to complete the toolkit a must or a should?
It's a must if they're accessing NHS systems. So if there's any sort of NHS data that's being held, it's a requirement to complete the DSPT. So if you're using something like GP Connect, for example, then yes, they must.
Lovely. We've just got another question in the Q&A section. Please, can you include a list of what the auditors need to be able to cover from Claire?
Yeah, I believe I've just copied the answer in for that one.
Perfect. Thanks, Claire. And then another question, how do you deal with sub-processes? For example, Google uses sub-processes from different countries outside of the EU.
So you need to make sure that whatever you are doing, you will always be in line with UK GDPR. So there are restrictions on where data processing can happen, where it's identifiable, and it's your responsibility to make sure that any software companies you're using that also align with that. The best way to do this is by completing a data protection impact assessment and working through that as an organization. The ICO have lots of guidance and templates on how to do this, and you can also call them if you have specific questions. I appreciate it can be really difficult for large companies like Google and Microsoft, but they tend to have servers which are based within the European Economic Area for exactly this reason.
Well, thanks, Katie. Another one, RA question 4.3.1. For large organizations, can our SIRO sign this on behalf of all IT admins?
Yeah, it's a good question. I don't know if you know, Claire. I think that might be one we have to come back to you about, Craig.
Yeah, I mean, the wording about it says the people within your organisation who are IT system administrators may have access to more information than other staff. Therefore, they need to be held accountable in a formal way to higher standards of confidentiality than others. I think it'll be a judgment call as to how much the threshold is for what you believe to be more data than others. So if you have CIRO, but then you have local administrators, and then you have your general staff members that have access to just the patient records of the people that they're caring for, does that threshold fall at CIRO level, or does it fall at IT member of staff level? That would be probably a judgment call for an individual organisation, depending on the amount of data and the type of data. If they're getting a lot of access to PII, then I would suggest that probably they would need to sign individually. Katie, do you have anything to add on that?
No, I think that seems sensible, Claire. I think it is about the level of access that they have and what kind of information they might be accessing. Can I repeat how to find out if your social care management system has completed the DSPT? Yes. So two options. You can talk to your account manager at the software company and they will be able to tell you. If it's a digital social care record supplier and it's been assured by NHS England as having met all of the standards required to be on the assured solutions list, which we will again put a link over to you, then if they are on that list, they have completed the DSPT. It's a minimum requirement to be on that assured list. I'm told GDPR is no longer enough. ISO 7101 extends what is required. UK GDPR is a piece of legislation, and ISO is an international standard, so I'm not familiar enough, I'm afraid, with ISO 7101 to tell you, but we do need to make sure that you're meeting legislation, and then any specific standards for healthcare products separately.
Great. I think that's the end of the questions just there.
Okay, that's fantastic. Obviously, there is some more time if people do have any other questions. What I'm also going to suggest, because of the number of questions which have come through, is after this session, we will pull all of them into a document and then email all of you with the answers written up afterwards as well. I know there's been a lot of information on this call, so I want to make sure people have opportunities to see that.
Just to respond to Kay's message, when will the Data Policy Builder app be available? The launch date is the 8th of October, so that's coming really, really soon. So that's just for the Bring Your Own Device Policy Builder. We do have an additional 10 policy builders that cover other areas, and they're going to be released in clusters of 3 over the next 6 months. So, for example, the data security, data policy and data quality ones will come as a package of 3. The information asset register, the record of processing activity, and the data asset register will again come as a package of 3. For that one, you're going to go into the tool once, put all of the information in for all 3 of those, but then it will produce 3 separate documents. So if you did have an inspection and they asked for your data asset register, then you could just produce the one document, so you're not having to duplicate all of the information that you're putting into there. But hopefully by March 2026, we'll have all of those 11 live.
Yeah.
And then Damilola, should third-party organisations that provide electronic MAR as a service need to complete a DSPT? They would be dealing with NHS data, and therefore I would imagine that, yeah, they will be a must.
They should. And yeah, any IT suppliers who are on the call, if you have questions about whether you need to complete a DSPT or not, if you contact the NHS England's DSPT team directly, they will be able to advise which category organisation you'd be, whether you need to complete a toolkit, and if there's any additional sort of information that you might need to be putting in there because you're holding personal identifiable information and health records.
And Graham's just asked a question about, is there a cost to the app? No, it's completely free of charge. It's something we've been working on for probably the last 12 months. We've been doing a lot of user testing, making sure that it's fit for lots of different sizes and types of organisations, and all of the different policies are completely free to use.
Yeah. By NHS data, what we mean is so anything which is part of an individual's health record. So yes, special category data that is identifiable or has been generated by the NHS. So doctor's notes, anything that would sit in a electronic patient record system, anything would sit in like a medication record system, which is about a patient, NHS data. Great. If those are all of the questions, then thank you so much for joining us today. We will give you some time back. We will send you a fairly robust email by the sounds of it, with access to the slides, recording, and the Q&A for all of this, and a lot of links to other resources and information which may be helpful. If anything occurs to you after this webinar which you didn't have a chance to ask, please do get in touch with us. We are very happy to answer questions. We're happy to find out more information for you. So with that, thank you so much. Really appreciate you all joining today.